There's 3 different candidates who I see as getting the best type of results for breast surgery. The first is a woman who's had pregnancies and has lost volume and shape of her breast and typically would benefit from an implant and a lift. The second kind of patient we see are younger women who are thin, who have a small amount of breast tissue and want to have a nicer, rounder, fuller look, who would benefit from a breast augmentation. And then the third type of patient we see are weight loss patients, typically have lost 100 or more pounds, who've lost significant breast tissue, who benefit from an implant and a lift. When I have a patient come for breast surgery, it starts out with the patient coming into the preoperative area where I draw the design of the surgery. Once the drawings are done, we go into the operating room, and then depending on what surgery I do, whether it be reduction or lift or augmentation, the breast is reshaped in a beautiful way where I make sure before we leave the operating room, I'm absolutely happy with how perfect things are. Then the dressings are placed, the patient is awakened from anesthesia, they're sent to the recovery room where they slowly, gradually come out of the sedation and then go home with a caretaker. So it's a very smooth process. We do everything we can to ensure safety as well as superior results. Typical downtime for the surgery is approximately 2 to 4 weeks. With that being said, most of my patients are feeling well within the first week and back to driving and walking car light duties. However, 2 to 4 weeks before things like heavy lifting, heavy housework, heavy aerobics. So by the end of the first month, back to all normal activities. As the plastic surgeon, my goal with my patient is to meet their expectations. So the communication is key. And I want my patient to trust me, to feel good about the process and be happy with my qualifications as a doctor. And so when we go to the operating room, I use all my skills, all my techniques, and everything I do is designed in terms of the surgical result to meet my patient's expectations.